Good afternoon, everyone, and thank you for joining us today. I am Joy Brunson Nsubuga, and I'm the Chief Operating Officer for Recovery Innovations, the operators of the Franklin County Crisis Care Center, and I am pleased to welcome you to the building today. As pioneers of the Crisis Now model of someone to talk to, someone to respond, a safe place to go, and someone to follow up, Recovery Innovations is proud to partner with the Alcohol, Drug, and Mental Health Board of Franklin County, with support from the Franklin County community at large, including the City of Columbus, to bring this innovative, state-of-the-art emergency behavioral health crisis care facility to life. Far too often, mental health or substance use emergencies were met with inconsistent, inadequate, and inappropriate interventions. We had at Recovery Innovations a radical vision, one that is embedded within this crisis care facility, care that feels like care. In a safe, warm, and welcoming environment, powered by peer support specialists who have been through their own challenges. The power of that vision and its implementation can be seen in the data. In just 6 short months of opening, we have seen over 2,400 individuals through the facility doors to receive compassionate crisis care. Over 2,400 opportunities to help individuals through an incredibly difficult moment in their lives and to get onto the path of recovery. 1,160 of those individuals were diverted from jails or emergency departments and into appropriate care. By providing stabilization without dehumanization, recovery without delay, paired with connection to ongoing resources as needed, our goal at Recovery Innovations is to return individuals to the community where they live. All of these data points are possible because of our vision of care that feels like care, and we are grateful for Adam H. and our Franklin County community for sharing and investing in the vision so that anyone, anywhere, can come to the crisis care facility for support at any time. With that, I am pleased to introduce City of Columbus Mayor Andrew Ginther.
Thank you so much, and it is great to be here. This is the first time I think I've been here since we've opened up. I think we came here a couple of times while it was being built and developed, a groundbreaking and absolutely beautiful space. I got a chance to meet some of the great staff that are helping our neighbors in some of the most difficult times. They're facing a real crisis for them, and just grateful to have everyone here today. Want to talk a little bit about the progress we've made and the next steps we will take to continue to evolve our alternative crisis response in our city. We're here to talk about common sense answers to some of our most challenging emergencies. My 2026 operating budget is before City Council right now for authorization, and it includes funding to sustain the progress we've made in alternative crisis response and to carry out the next leg of the journey. I think everyone here appreciates that every emergency circumstance requires trained, expert attention. And when an emergency involves an individual experiencing trauma or mental health or addiction crisis, a trained clinician is best positioned to help. When someone needs stabilization and ongoing support, they should get a pathway to services, not a stay in a jail cell. Alternative crisis response is a cornerstone of our comprehensive neighborhood safety strategy. Our safety strategy calls for prevention, intervention, community transformation, and enforcement experts to work together, not in silos. We've been adopting alternative crisis response strategies as a city since 2021 because we understand that individuals in crisis are best served by resources tailored to their needs, but also that the community benefits too when our emergency personnel and resources are used to do what they do best. Since 2021, we have enhanced the work of our Columbus Police, Columbus Public Safety, and public health teams in a multitude of ways. We've added 911 call takers and dispatchers to better facilitate right response unit calls. We've purchased dedicated alternative response vehicles to service crisis runs. We've streamlined the process to transfer an individual in crisis from 911 to 988 when our right response clinicians are unavailable to answer a call for help. We established a program called SPARK, which stands for Specialized Program Assessing Resource Connectivity. This program engages older adults and residents with disabilities who frequently contact 911. In 2023 and 2024, this program helped reduce EMS utilization among high-frequency callers by more than 40%. In addition, the city's Rapid Response Emergency Addiction Crisis Team has made thousands of home visits and contacts with overdose survivors and distributed Narcan kits at community outreach events. And our community has invested in this incredible facility and a continuum of support and care that sees our residents past a moment of crisis and toward a brighter future. As I shared with you a few weeks ago, our Department of Public Safety is adopting a nurse healthcare navigation line designed to work alongside our existing 911 operations. In 2024, our fire division responded to 145,000 EMS calls, and only 55% of them resulted in a trip to the emergency room. Under the Navigation Line program, when certain criteria are met, a registered nurse will handle the call, and if appropriate, help patients identify care that's more practical or cost-effective, while still serving their needs. The philosophy here and with the alternative crisis response is the same. Get our residents to the resources that are most appropriate for their needs. But we're not stopping there. In 2026, the city will invest $8.8 million to continue and expand our alternative crisis response programs. This includes $1 million in new funding that will, for the first time ever in our city, equip the city with a team of 5 non-uniform experts who will respond to mental and behavioral health crises. This means that we'll carefully triage calls for help that relate to mental health. When it's clear that there's no threat of physical danger, we'll dispatch a team consisting of clinicians and peer supporters, not police, to the situation. This will help people in crisis to get the care they need, while keeping our officers available to attend to emergency situations that they are best qualified to handle. I'm very excited about this for the first of our in city history and for our residents. We'll also provide our right response unit with an additional clinician embedded in our 911 call center to help evaluate the right ways to support an individual in crisis. That will bring us up to 11 full and part-time clinicians assisting our police when they respond to these situations. And this makes everybody smile. Our 2026 funding will also provide for a therapy dog to ride along with our clinicians on the mobile crisis response team to help us de-escalate situations. We'll also create an alternative response advisory panel comprised of industry professionals who advise our departments of public health and public safety on proven and emerging alternative response practices. This is what modern public safety looks like. I want to thank Emily Cole, Jenna Wiley, and their organizations, along with the ACLU and the Columbus Safety Collective, who have together gathered more than 30,000 signatures to put a measure on the May ballot that would codify our city's commitment to alternative crisis response. The public support they have documented demonstrates that the community recognizes the importance of alternative crisis response methodologies, values this work, and wants us to continue. I believe we're already surpassing the expectations articulated in the current ballot language. So I've charged my leadership team with working closely with you in the coming days and weeks to make sure we're all raising the bar for this work. We can go further and faster together to meet our neighbors where they are and get them the services they need. Because when someone in Columbus dials 911 in their darkest moment, they should know that the right help is on the way. And now I'd like to bring up our outstanding and amazing Health Commissioner, Dr. Mashika Roberts, for her to share a little bit more. Doc?
Thank you so much, Mayor Gunther. Columbus Public Health is proud to work with you as well as our partners at Public Safety, Columbus Fire, Columbus Police, and AdamH to offer alternative crisis response programs to our residents in times of need. Our alternative crisis response is a collective effort. It's also a commitment. It's a commitment to meeting people where they are and connecting them to the services they need when and where they need them. Our compassionate clinicians in the Right Response Unit are our boots on the ground, working right in the 911 call center to triage calls and determine the best response for each caller's unique needs. So instead of a traditional police or fire response to every single call, our clinicians identify the specific needs of the caller, whether it's a mental health support, addiction services, or other social needs. They are there to listen and to provide the caller with the resources they need for their own unique situation. And for the calls that still require a traditional police or fire response, the Right Response team has been able to de-escalate volatile situations and provide pre-arrival instructions before officers or paramedics arrive at the scene, helping our first responders as well as the caller. Last year, our Right Response clinicians answered over 7,100 behavioral health calls for suicide attempts, well-being checks, mental health crisis, domestic violence, as well as follow-up calls. Of those calls handled by the Right Response Unit, more than 2,500 calls self-collected for the option for mental health assistance only. Thanks to the clinicians' care, they were able to provide a non-police response for 37% of callers on average. Additionally, alternative crisis response also includes the Mobile Crisis Response Unit, which pairs a specially trained Columbus police officer and a Columbus Public Health mental health clinician to de-escalate and stabilize crisis situations. Together, they conduct a needs assessment and connect or transport patients to the appropriate resources. Just last year, our mobile crisis response team responded to over 2,700 runs for mental health follow-up, suicide attempt, well-being check, and civil disputes. This caring and compassionate team also transported nearly 60 of our neighbors to higher levels of care. But it's important for all of us to remember that these are more than numbers. Behind each number is a person. Our family, our neighbors, our friends, our coworkers. Our caring and trained professionals are there to lend a hand when needed, and they are literally changing and saving lives. Let me share one story with you. A woman recently wrote into the mayor's office about their child who lives with bipolar disease and has acute bouts of mania. She shared that several years ago, this child had a manic episode in another jurisdiction where they had fewer resources than we did. When they called 911 for help when their child's mania got out of control, law enforcement showed up. And although law enforcement was very professional, they ended up charging their child, even though they had to go to the hospital. So after the child was released from the hospital, and this was an adult, not a child per se, after the individual was released from the hospital, they had charges they had to face. And the family spent a lot of time and money and anguish trying to get those charges off of their record. So fast forward to recently, the family now lives in Columbus jurisdiction. And after a few days of unsuccessfully trying to manage their child's mania with the supervision of their psychiatrist, the parents realized they needed to call for help. So they called 911 and they were connected with a right response clinician. Within 10 minutes, 2 standard patrol officers were at their door. The mother said that these officers were clearly trained in how to respond to a mental health crisis. She said the officers ascertained that there was no immediate physical threat to anyone in the household, and they remained outside to not further upset their son until additional resources arrived. A few minutes later, the mobile crisis response team arrived. She shared that the officer and the clinician were amazing and were a calming presence. They took a few they took some time to get some history from both the mother and the dad before engaging with the client. She then shared that her husband and her had expressed to the mobile crisis response team exactly what facility their preferred location was for their child. They also shared the insurance information so that that transition could go as smooth as possible. She closed her letter by saying that while caring for a loved one with a severe mental illness is not easy, it was made a lot better this time here in Columbus, thanks to the mobile crisis response team, which provided a better outcome for her son as well as for her family. So you see, our alternative crisis response teams are changing lives, and it's changing lives all across our community. Whether it's our trained counselor in the 911 call center to listen and provide the right response for a mental health crisis, or social worker who visits a caller's home to listen, hold their hand, and transport them to a place like this, the Franklin County Crisis Center, to get the care they need. Columbus Public Health and our partners are there, and we care. Together, we are providing the right response to our neighbors when they need us. We are really excited about the mayor's additional funding for another alternative crisis response approach. It will expand the good work that we're already doing right here in Columbus by adding more mental health counselors or clinicians to respond without law enforcement, adding a clinician in the 911 call center, expanding our hours, and yes, providing a support dog as part of our mobile crisis response team. We are doing great work here in Columbus, but there's even more we can do to help our residents. We are grateful for the support, which will help ensure that the right help is there when everyone in our community needs it. Through our shared commitment and comprehensive alternative crisis response efforts, we are positively impacting people and communities across our city. We look forward to continuing this great work with Mayor Ginther, as well as all of you. A resilient, healthy, and safe community which consists of families, children, adults, and all of us in this room. It is my pleasure now to welcome one of our partners in this great work that we're doing, Sue Valillo from Adam H. Sue?
Good afternoon, everyone. Thank you, Mayor Ginther, for the invitation to speak today and for your investment in the Franklin County Crisis Care Center. And thank you, Dr. Roberts, for your partnership in this work. The Alcohol, Drug, and Mental Health Board of Franklin County, or ADAMH, has spent years working alongside community partners to intentionally build a comprehensive crisis care continuum. This work is grounded in a clear goal, ensuring that Franklin County residents experiencing a mental health or addiction crisis have someone to call, someone to come, and somewhere to go. Today, I'd like to briefly highlight each part of the crisis continuum and share how strong partnerships have been essential in building a system that connects individuals to the level of care that best meets their needs. The first entry point into the system is someone to call, or the 988 Suicide and Crisis Lifeline. Since its national launch in July of 2022, 988 provides free, confidential, 24 hours a day, 7 days a week, support to people experiencing a mental health or substance use crisis, suicidal thoughts, or emotional distress. Here in Franklin County, ADAMH partners North Central Mental Health and NetCare Access answer these calls, texts, and chats, ensuring individuals are connected to local agencies who are experts in crisis calls and knowledgeable about available community resources. Last year, more than 26,000 calls to 988 were answered. Significant progress has also been made, as Mayor Ginther mentioned earlier, in improving coordination between 911 and 988. Warm handoffs started very recently between the two lines, and it is our goal to see other jurisdictions in Franklin County follow the City of Columbus lead. When crisis cannot be resolved on the call, someone to come becomes critical, and our 988 call centers can send help directly to the person in crisis. Community-based mobile teams meet individuals where they are and provide in-person support during their most difficult moments. In January of 2026, ADAMH funded NetCare Access to launch a non-police community mobile response program. Today, teams comprised of a clinician and a peer supporter are available 24 hours a day, 7 days a week throughout Franklin County. They respond to the crisis and are able to follow up to ensure individuals are able to complete connections to ongoing care. NetCare's community mobile team responded to 1,146 individuals in 2025. These mobile teams work in partnership with other alternative crisis response efforts that you have just heard about, the City of Columbus Mobile Crisis Response Unit, Spark, and REACT, as well as teams offered by Southeast Healthcare, the Veterans Administration, and Nationwide Children's Hospital. For individuals who need a safe place for crisis care, the somewhere to go is now the Franklin County Crisis Care Center. The center is open 24 hours a day, 7 days a week, and can currently support up to 40 individuals in need of crisis intervention and stabilization. Individuals may walk into the center or may be brought to the center by mobile crisis teams or first responders. The center offers an integrated model of care, bringing together recovery, clinical, and medical services in one place. As the facility continues to expand, future phases will add a behavioral health urgent care for lower acuity needs and inpatient capacity for individuals who require longer-term stabilization. Recovery Innovations, the center operator, is experienced and brings experience and an evidence-based approach to crisis care. I would like to thank Joy from RI and her colleagues for their expertise and their partnership. Additional partners in this center include the Ohio State Wexner Medical Center, which provides on-site physical health care, and Uptown Pharmacy, which offers on-site pharmacy services to ensure individuals leave the center with prescriptions they need until their next community provider appointment. These partnerships demonstrate collaboration that is essential, not only in planning services, but also in delivering them. This same cross-sector collaboration made this center possible, bringing together community partners and all levels of government to strengthen our behavioral health continuum and move away from emergency rooms and law enforcement as the default response to behavioral health crisis. The progress that has been made and the work that still lies ahead depends on continued collaboration across jurisdictions and systems. Thank you for your time today, and I welcome Mayor Ginther back to the podium.
Thank you, Sue and Dr. Roberts, Joy. It's a great day for the city of Columbus to update and give a status report on our progress, but also announcing the expansion of the alternative crisis response pending council's approval of the budget. We're very excited about the great work we're doing. Not only does this get people the care they need in the midst of a crisis, it also helps to make sure that our police officers and firefighters and EMS are focused on real emergencies in the community that need their immediate attention, help us lower our response times and help people get what they need and keep folks out of emergency rooms and jails, the last place they belong. It'll make a huge difference for our health systems and our communities as a whole. So happy to take any questions from the press about today's topic, but no, I'll stick around to answer any question you may have, including about our beloved Buckeyes coming up short in 2 big games last night. That Michigan one still stings. Jordan.
Mayor, will this expansion cover the entire city and 24/7? Because I know in the past the pilot had limited hours.
Yeah, I think this will be the first time ever we've had non-police, non-sworn personnel response. So this will all be clinicians and social workers and mental health professionals. And it won't be 24/7 initially. But our hope is to add it and grow it over time the way we have the rest of the alternative crisis response system. Is that right?
What is the obstacle in making it 24/7 that families have asked for?
Well, what we've done is we've tried to inform this. I'll let Sue and Dr. Roberts speak to this as well. We also have taken a look at when those calls come in. And if I remember correctly, the vast majority of those calls are coming in the afternoon and early evening hours, not necessarily overnight or first thing in the morning. So this is a data-informed approach. But you're right. I mean, any time one person isn't getting what they need, we're going to continue to focus on that and grow that. But this expansion will be informed by and driven by data and calls for service into those times. But the plan would be to grow it and expand it as we have everything else with alternative crisis response over time.
Some families say they won't call 911 for a loved one in crisis because they fear police response. What would you tell them today about how this plan will reduce that risk in reality, not just on paper?
Well, I think we've talked a little bit about it, and I'll let Sue and Dr. Roberts speak to this as well as professionals and direct providers of these services. But, having, the triage, having, folks that are part of the navigation when those calls are coming into 911, the overlap now and the handoffs with 988 and 911, as we've talked about, will make a huge difference. So I think families out there that have someone that is battling mental health and addiction issues can, with confidence in Central Ohio, call 911 or other ways to access the system to get what they need. And that's what today's announcement and our expansion of alternative crisis response is so important. Dr. Roberts, you want to add anything?
So I would just echo what the mayor said in terms of the triaging that happens by our right response unit, and providing that information to the responding officers should make families feel much more comfortable calling 911 if they need to for a loved one who's having a mental health crisis. I would also add that we're very fortunate here that almost all of our CPD officers have had training on crisis response in dealing with mental health. And I think in the example I shared with you, they are equipped to handle kind of that first line of information with empathy to those who call. I think we have a very great system, a very good system here, not only what the city's doing, but what many of our partners are doing, that families should not hesitate if they're in need to make that call, because we will do our very best to make sure they get the right response for the need they have at that time.
You want anything, Sue?
I will just briefly share how critical it is that we have this interoperability between 911 and 988, and the ability the caller shouldn't worry about what number they call. They should call 911, they should call 988. It's the responsibility of the call taker to ensure that that person gets connected with the level of care they need, and they are well versed in being able to transfer between lines to ensure that the right help gets to the individual.
How big of an issue is that, about that transfer? You mentioned it's not 100% in terms of 911 to 988.
So in the city of Columbus, it is 100%. So there is the right response unit, and that the limited hours the right response unit is not available, those calls get transferred to 988. So there is always, on the city of Columbus, 911, there is always a behavioral health response for the individual who's calling in.
So I'm not sure who would be best to answer this question, but I heard you mention it briefly. The Columbus Safety Collective has an initiative on the ballot, and so if that passes in May, I mean, how is this going to work hand in hand with that? How is that going to impact what we got going on with what you've announced today?
We're working on that. Clearly, we believe in the spirit behind the coalition that has gathered these signatures. Over 30,000 of our neighbors signed these petitions. There's huge support for alternative crisis response. That's why we've been doing this for the last 5 years and why we want to continue to grow and expand it. We believe we probably are doing potentially more faster than is called for in the current ballot language. And so I've asked the senior leadership of the mayor's office to work with our partners to see if we can work together on going further faster together.
So to be clear, Mayor, I know this comes up for council on Monday, putting this on the ballot. Do you support this going on the ballot, or are you saying that this should?
Well, I clearly support this work because we've invested several $1 million in making it happen for a long period of time. So I support the collective's mission, their purpose, the spirit of this, and we're going to continue to work with them to see if we can do more together, faster, and go further as a city.
But to clarify, do you think this needs to go before voters or not?
I think, quite honestly, it has through our budget process and the election and re-election of mayors and council members, but certainly support their efforts and recognize the commitment of the collective, but also the 30,000 neighbors who signed it. And so we're going to continue working. People hire mayors to solve problems, and we're going to continue to work to solve this together.
And with this expansion, I mean, how much of a difference do you think prior to the expansion and then after the expansion now? What kind of difference is that going to actually make tangibly in the community and for people who need this kind of help? I mean, how much impact is it going to have?
I'll let Dr. Roberts and Sue speak more to that. They got Kevin much better answers than I gave him earlier, so I'm sure they'll have better answers. But I think the bottom line is if there's any hesitation based on the story that Dr. Roberts shared, there's so many people that come to Columbus that weren't born here, right? Or the overwhelming majority of people that live here weren't born here. And so they might have different systems in the communities they grew up in or where they were raised. And if you're new to this community, or if you were born and raised here, as we continue to evolve, we need to continue to make sure we're offering the services our neighbors need and having the right response. And so having a non-uniform response when appropriate, after being triaged appropriately, we think will do even more to keep our cops, firefighters, and EMS personnel responding to calls for service that need them, and then getting our neighbors who are in crisis the help they need in the way that they need it, because the last place they belong is jail or in emergency rooms. Doc or Sue?
So the expansion is definitely going to get more people into care. And as the mayor alluded, it's definitely going to allow our paramedics and our police to respond to more critical issues and allow our civilian team, as well as our MRC team, our medical our response team, mobile crisis team to respond to those issues. And then those individuals who have less acuity, who might not need the police officer, they're going to get the civilian team. But I do think in the end, what we will see is the wait time, the response time will be lower across all the calls. And I think we're going to get more people into care and the treatment they need. So hopefully we can really make an impact here in our community around behavioral health and the treatment that individuals need and deserve. I don't know, Sue, if you want to share anything else different?
I will just share from the program that we have with NetCare that provides mobile crisis teams out into the community. When a NetCare arrives on the scene, we're seeing about 70% of those crises resolved right there immediately. No need to elevate this to a higher level of care. Police are called to assist in less than 2% of the time. So we know that this helps people get their needs met immediately. And the opportunity to expand these services in Columbus is nothing but a win for everyone who is in crisis and needs that care to be able to come to them.
That's the time we have for this, but Mayor will stick around.
Yeah, I'll stick around for one-on-ones, and if Dr. Roberts and Sue have a few minutes, I'll have them stick around too. Thanks, everybody.